Why there is still no vaccine for coronavirus. The COVID-19 has shaken up the world and forced scientists and researchers to hasten their process to develop a vaccine against it. However, there are quite a few reasons why everyone has had a hard time actually making one as soon as possible. Welcome to Curious Minds, and today we'll be explaining why there is still no vaccine for COVID-19. Make sure to stay until the end of our video to learn precisely how a vaccine works and why COVID-19 has made it difficult for one to be developed. Also, don't forget to subscribe to Curious Minds for more great content like today. Without further ado, let's begin with our countdown. So let's start by explaining how a vaccine works with all the necessary details, and how development of one could be stymied by the fact that COVID-19 is a virus and not another type of microbe. Vaccines are simple in principle, but complex in practice. The ideal vaccine protects against infection, prevents its spread, and does so safely. But none of this is easily achieved, as vaccine timelines show. The main concern is that coronaviruses do not tend to trigger long-lasting immunity. If the natural infection doesn't give you that much immunity, except when it's a severe infection, what will a vaccine do? It could be better, but we don't know. If a vaccine only protects for a year, the virus will be with us for some time. The genetic stability of the virus matters too. Some viruses, such as influenza, mutate so rapidly that vaccine developers have to release new formulations every year. So far, some genetic changes have been spotted in the virus's protein spikes, which are the foundation of most vaccines. If the spike protein mutates too much, the antibodies produced by a vaccine will efficiently be out of date and might not bind the virus effectively enough to prevent infection. In a rush to develop a vaccine, safety must prevail as a priority. Scientists will have to check extremely carefully for signs of dangerous side effects. What countries are working to create a vaccine? United States. 2 candidates are being tested in the United States. The first human trial in the country began in Seattle in March, with a vaccine developed by Moderna Inc. In April, trials began in Philadelphia and Kansas City for a second candidate, which is being developed by American biotech firm Inovio Pharmaceuticals. China. Trials for 4 other candidates are taking place in China. The Beijing and Wuhan Institutes of Biological Products, arms of state-run Sinopharm, are carrying out trials on another 2 candidates, and experiments for a vaccine developed by biotech firm Sinovac are also underway. United Kingdom. The University of Oxford commenced human trials for a candidate in late April, with $25 million in funding from the UK government. Germany. Pharmaceutical giant Pfizer is working together with German firm BioNTech and Chinese firm Fosun Pharma on a vaccine that started human trials in late April in Germany and soon after in the United States. So, is the virus here to stay? Being honest, yes. Hopes for eliminating the virus start with a vaccine, but do not end there. The virus will still be tough to conquer with a vaccine that lasts for years. As long as the infection rages in one country, all other nations are at risk. So for us to be truly free from it, we need to wait several years. Gavi, the Vaccine Alliance, proposed to boost the availability of vaccines around the world through an advanced market commitment. If the process of getting a vaccine, testing it, proving it, manufacturing it, planning for its delivery, and building a vaccine program all over the world will take as long as we think, then we should start planning it now. How will we live with the virus? People will have to adapt, and life will change. People must play their part too, by maintaining hand washing, physical distancing, and avoiding gatherings, particularly in enclosed spaces. For instance, at restaurants, tables will have to be shielded from each other, and serving staff will follow strict rules to prevent spreading the virus. It is too soon to know how the pandemic will pan out. We still don't understand the destiny of this virus. So, what do you think of the effects of COVID-19 in the world and living with it without a vaccine? Let us know your predictions in the comments below. Also, make sure to leave our video a like. Share this video with your friends and also subscribe to our channel and turn notifications on for more intriguing content like today. We hope you enjoy our video, and we'll see you next time.